afternoon, everybody, and welcome to our geriatric clinic today. We'll go ahead and start off with some introductions. I'm Amy Smith, the ECHO assistant.
I'm Tracy Bowles. I'm the Washoe County Public Guardian.
I'm Sue Weil. I'm the Deputy Public Guardian.
I'm Kelly McMillan. I'm a social worker at the Sanford Center for Aging.
And Patty Swagger with the Sanford Center for Aging.
I'm Stephen Hockenberry, Deputy Public Guardian.
Before we get started on the PowerPoint, does anyone have any?
Can I introduce
Oh, yes,
myself?
sorry about that.
Hi, I'm Umanga Sharma. I'm UNR geriatrician.
Awesome. Anyone have any cases or questions before we start off? And go ahead.
Great, thank you. So, as I mentioned, my name is Tracy Bowles. I am the Washoe County Public Guardian. I have only been the Washoe County Public Guardian for 5 months. Prior to that, most of my experience in guardianship was with children. And so a lot of this is new to me. So I have also brought with me my experts, which are my deputy public guardians who are sitting alongside with me. And so they'll be great people to answer questions. I will give a brief overview of guardianship. I tried to keep it to the statute, the NRS statute, because I know that there are people who listen outside of Washoe County, and I didn't want it to be too Washoe County specific. So we'll review a little bit of the statute today, kind of talking about what is guardianship. We will explain some of the roles that the public guardian plays. Most of that I will give a little bit of specific information about Washoe County, but I'll also be clear that each county has its own public guardian, and they may have slightly different roles than I play or different procedures. We are going to talk about the process for obtaining a public guardian. Some of this will be a little bit more specific to Washoe County, but the statutes are statewide. And the part of our presentation where we want to talk about the legal determination for incapacitation, which is called competency, and the medical determination for incapacitation, which we often refer to as capacity. This part of our presentation was primarily going to be given by Judge Eakin Walker, who unfortunately is delayed in court today. He had a very heavy docket, and we hope he will join us by phone in a while. But if he cannot join us by phone, then we'll try to give you some specific information on that as well. And then there are a few new laws we wanted to discuss today that impact guardianship, that might be good alternatives to guardianship. And we will finish with a bit of a case study and some discussion. I did skip a little slide in here about conflicts of interest. I don't have any conflicts of interest. I am employed by Washoe County. I am appointed by the commission, the county commission. I serve at their pleasure. And all of our funding for the Public Guardian's Office comes out of the general fund for Washoe County. All right. So the definition of guardianship, this is from the National Guardianship Association. And it really highlights the fact that guardianship is a legal process. It is overseen by a court of law. The decisions are made within the court of law. And it's utilized when a person can no longer make or communicate safe or sound decisions about his or her person or property, or has become susceptible to fraud or undue influence. Because establishing a guardianship may remove considerable rights from an individual, it should only be considered after alternatives to guardianship have proven ineffective or are unavailable. So we start with this basis because we want people to really understand that guardianship can be seen by some people in the community as, well, gosh, we can't figure this case out, let's get them a guardian. And we really want to highlight that it is really taking away people's civil liberties when they get a guardian. And in that vein, it should be really the last alternative that we're considering for individuals. And there are lots of other legal and social and service options available for folks that are struggling with some of these issues. So we put that out there at the beginning to say, just think of us sort of last, right? and know that it really is a legal process that's often pretty stressful for people that are going through the process as well. So guardianship of the person is a type of guardianship. We can either be awarded or ordered the guardian of the person or of the estate or of both. There are some special guardianships and there are temporary guardianships, but the most common guardianships that we see are guardianship of the person or of the state or both. And so NRS 159.079 really outlines what the guidelines are for guardianship of the person and what our responsibilities are. So we are looking to maximize independence of the person. It is something we are charged with doing. We look for placement for people and we monitor those placements to make sure that they're appropriate and that they are the least restrictive for those individuals. We will monitor and assure personal needs are met, whether that be the medical equipment that they need, food, clothing, and shelter, recreational kinds of things. Those are things that we oversee and make sure those are met. We gather a lot of information on our persons, and we report that all back to the court annually or as needed. We may also go back to court for special instructions if we're unclear how to act in a particular situation. We do a lot of providing informed consent for medical treatment. We do oversee the socialization of that individual. We make sure that they are socially active in a vein that's consistent with their choices. We consent to releases of confidential information on other persons for the purposes of making sure that they are getting the services that they need. And we also consent to non-medical services like education and counseling. We kind of listed these sort of in the order in which the importance of the time that it really takes for us to do these kinds of things. So to give you a little bit of a perspective of where we spend our time. So we kind of spend our time at the top of the list and not so much at the bottom of the list. So 159.083 identifies some of the responsibilities around guardianship of the estate. And that estate is defined as real or personal property. This real property is things that are attached to the earth, like homes and land. And personal property is anything that might be contained within those structures, anything that person might own, that might be in their apartments, anything that's subject to ownership. It also means their finances, their monies that they may have. And so one of our primary goals is to marshal and protect those assets from loss. Unfortunately, a lot of our individuals are subject to exploitation. And so one of the very first things that we try to do when we get into a guardianship of the estate is really marshal those assets together, figure out what they are, where they're located, and how we can protect those from future exploitation. We have to get court approval prior to selling any kind of real property. So that is a court process that we have to go to, where people can actually bid on property within the court setting and can purchase property from there, or we can also go through, we use a realtor as well and sell those properties, but we have to notice individuals and any interested parties that might be related to people who are protected. We sell the real property. We get appraisals on property. Sometimes we might find an entire storage unit full of property that we have to inventory, appraise, and then decide what we're going to do with those items in there. We do get court permission to gift property at times to family members. We get court permission to give property to family, personal objects like photos and family mementos. And then we will sell personal property if folks need those monies to be able to fund their cost of care. So if that's for, they need that to be able to continue to manage their cost of care. We do manage their finances on a regular basis. So we are service representative payees for our people, collecting their pensions, social security funds, retirement funds. we pay their bills so that we can sometimes maintain properties or just anything that they currently have. We file taxes for each of our people that we are the guardian for the estate. And then we have to report annually on all of that to the court, what we've done with all of our funds. We do a lot of record keeping.
I just have a question.
Could you speak a little louder? They're having a hard time hearing you.
Yes, absolutely.
So you're the public guardian. So in other words, that you represent that person in terms of protecting them. But there's also an individual who might be a private guardian. In other words, so how are those roles for those people who act as a private guardian
Yes.
different than your role as a public guardian?
It's a great question, and we're going to kind of talk about a little bit of that in this presentation. And in fact, I'll just kind of, well, we're going to get there a little bit, but private guardians and public guardians generally do the same things. However, public guardians are subject to additional laws and regulations and are governed by a different statute under NRS 253 that private guardians are not. And so our function might be very similar, but the public guardian often has a lot more regulation attached to their job.
And how come someone might have a private guardian versus a public guardian? How does that happen?
Yeah, so that's a great question. So a lot of times it has to do with funds, and it has to do with if a person can afford a private guardian. So private guardians, they charge fees associated with their work. The public guardian will serve regardless of a person's ability to pay or not. Most of our people that we serve for are indigent. So while we may calculate the cost of guardianship, we often do not get reimbursed for those services. Yes. So reasons a guardianship might be needed, under NRS 159019, the primary reason is that the person really lacks capacity as defined by that statute. And it's preventing them from being able to receive and evaluate information or being able to communicate in order to meet their basic needs. So some of those things that might affect a person's inability to kind of receive information and communicate might be medical diagnoses that many of you are familiar with, like Alzheimer's or dementia, some other kind of neuroassaultive disease, having experienced a stroke or a traumatic brain injury, those types of things. And that's not a comprehensive list. It's a very small just list of examples just to kind of get you thinking about what might be a reason a person may not be able to communicate or receive or evaluate that information. Other types of behaviors that might play into getting a guardian or needing a guardian is inability to provide that informed consent for medical issues, or inability to maintain their funds. They can't do the required paperwork that they need to do to keep their benefits coming in. And while they might be eligible for benefits, they haven't been able to manage that aspect of their lives. They may not have the ability to attain shelter. They may not have the skills. So they might, it's not just somebody who's homeless and is sort of choosing to be homeless or has the ability to manage those, but maybe has fallen into a circumstance where they become homeless as a result of not being able to manage other aspects of their life. And then a lot of, like I mentioned before, some of these folks have been exploited. We gave some data just for Washoe County Public Guardian, just to give you an idea of whom we see or the reasons why people are referring to us. These are not discriminate numbers, so there might be multiple reasons for one person to come into us, into getting a referral to our office. It might be mental or cognitive issues. That's the largest degree of the people who we see. Financial issues is about a fifth of the population that we see. Not having adequate support. They just don't have people to help them with these kinds of things. Or they had a guardian and that guardian has said, I can't serve anymore as the guardian. I really need the public guardian to step in. We see sometimes people needing guardians after family members pass away. They had a spouse who was taking care of them and their spouse passes away. Sometimes placement issues are a large reason why we may see petitions for guardianship. And then the lower percentage is that abuse or neglect, and that might be self-neglect as well. Inability to really provide for themselves, to feed themselves, clothe themselves, shelter themselves. So we mentioned earlier that there might be a private guardian. You will see people like myself, public guardians, and then there are lots of family and friends out there who serve as guardians for their people. And we are all governed under 159, but public guardians are also governed under NRS 253. So this is a little infographic that we put together. This is a little hard to see, frankly, because some of the font is small, and I apologize for that. But really, it demonstrates all the people that we might interact with or a guardian might interact with. So at the very center is that protected person, and then the guardian, and then thank you, that helps a little bit. And then circling out from there, you might have resource agencies and families and friends, social workers, medical providers, long-term care facilities, supported living arrangement providers, mental health services. And then you'll see some of the larger organizations outside of that some of you work for, like ADSD and SRC, and our hospitals are up there, the VA is up there, that connect with that protected person. And then the other folks that we deal with are realtors and private insurance and Social Security Administration and Medicare and Medicaid and financial institutions, the ombudsman. So it just demonstrates how complex guardianship is. It also demonstrates how difficult it might be for a family member or friend to do this. And so why they might opt for a private guardian that can manage all these different pieces. And why some people ultimately end up at the public guardian's office, because this can be such a complicated process. And you need to know a little about a lot of these things. So. All right, so our office, there are just a couple demographics in our office. There's just one public guardian in our office. We have 2 deputy public guardians who are with me today and who act as case managers. We have 9 guardian case managers. Those are the people who are out there doing the bulk of the work with protected people, visiting protected people, interacting with all of those agencies that were on the last infographic. And then we have 4 support staff. So we have an account clerk, 1 and 2, and an office assistant and an administrative assistant that really do the bulk of the financial part of managing of the estate and really helping assist us with those court reporting criteria that we have. We have an average caseload size of about 30. That's not each case manager doesn't have 30. But across the average, they have about 30. We really try to not give our newer case managers a really large caseload. We try to train them really well and incrementally increase their caseload as they are getting more adept at their positions. So some of our more experienced case managers actually have more than 30 as a result. The national average, or the research indicates we really should be around 20. And so that also highlights the fact that, you know, in Washoe County, we're not at the national average. We aspire to be there. We think that that's the best practice, is to be down around 20. But unfortunately, we're not there. We don't have the funding to be there right now. But one of our strategic goals in Washoe County is to have appropriate sized caseloads. So that is one of my goals, is to help us get closer to that 20. So that's a little infographic that just kind of shows our people. As of June, we had about 257 protected people. Our average, that's the yellow one that you see, was 30. So what does the guardianship process look like in the state of Nevada? Essentially, anyone can petition a court for guardianship of a person or an estate. You, as a private citizen, can petition, a hospital can petition, anyone can do that. Our office does not petition for guardianship of anyone in Washoe County, although there are some public guardians throughout the state that will do that. Our office finds that a conflict of interest, and so we do not do that. When the public guardian is sought, we do need to know about those petitions. They do need to come to us so we are aware that they might be coming to us. And so there is a statute that says you need to send it to the public guardian so we can be aware of it. There is a great link right here on this page that takes you to the Self-Help Center for Washoe County. It doesn't have just specific information for Washoe County, so there's a lot of valuable information on that link, even if you're outside of Washoe County. I would encourage you to take a look at it. So a petition has to be filed with the court. All interested parties and the proposed protected person themselves also have to be noticed. So there is a noticing part of this where that takes some time to make sure everyone is aware of the hearing. And then it's set. Right now, our guardianship court is pretty busy. And so our guardianship hearings are being set out about October now, to give you just an idea of what kind of delay that might be. Out of those hearings, a number of things can happen at those hearings. People can contest the guardianship hearing. They can agree to the hearing or the petition. They can, and so from there, depending on if they're agreeing to the petition or they're contesting, there might be a settlement conference that occurs. There might be mediation that can occur out of that. Ultimately, it would come back to the courts, and the court would then issue their ruling. And they may find that the person does not meet criteria for a guardianship, if that's not needed. They may find just a guardianship of the person is needed and not the estate, even if that might be being sought in the petition. They may find a full guardianship is needed. And so that once that happens and the judge makes his order, if a guardianship is awarded, then letters of guardianship are issued. For private guardians, well, actually, maybe not for private guardians, but for family and relatives, that process actually happens usually the same day. They can kind of go to the court and get their letters. For us, it takes a little longer. We wait for our orders, we issue our letters, and that can be a process that can take a couple of weeks sometimes to get orders and letters. And I mention those time frames because a lot of times people think, oh, this person needs immediate help, let's get them a guardian. We'll just get them on board, we'll get them a guardian, and that will kind of solve everything. But because this is a court process, it takes a long time. So guardianship is not an answer to an emergent situation by any means. It is definitely a process. And our office will often get calls to say, this is an emergency, how can we do this? And we can often give some advice to people that are in medical facilities or social workers that may call, that are interested. And we can say, you know, maybe there's some other alternatives that you can pursue prior to, that are more emergent, and rather than just going straight to a guardianship process. All right, so this is where we were hoping to have Judge Walker. I'm looking at our screen and I don't see that we have him yet. So we might come back to this, but we'll give you just a little bit. I think what I'm gonna do, just in the interest of time, because he might be available later, is I'm gonna just skip this little piece and we'll circle back to it in a little bit. So let's talk about some alternatives to guardianship. Remember, guardianship is a process by which you are receiving, evaluating information, and you're making decisions. And so anything out there that helps with some of those things can be an alternative to guardianship. This is certainly not a comprehensive list, but this is some options for people who are looking to have some help and maintain their independence, and some things that can be employed. So powers of attorney for healthcare or financial management, where you actually identify your person and say, these are the people I would like to make decisions for me. And that's a document that you can go to doctor's appointments, you can go to banks, you can do the business that a person needs to do in their life when you have a power of attorney in place. A living will. Those are documents that help tell other people what you would like to happen for yourself while you are alive. It's a way for you to indicate your wishes and desires that people will follow, even if you're not able in the moment or later on in life to communicate those things. Trusts are often employed to really help manage the estate of a person. And so things can be protected within a trust. The trust officers can pay bills, they can manage the finances, they can make decisions in alignment with whatever the wishes of the person who set up the trust state. And they continue to function independent of the person. And so if a person becomes incapacitated, that trust could still function for that person. Case and care management services, I put them both because some people say case management, some people say care management. There are some differences to those things, but that's not what this presentation is about. So those types of services are available for people to help navigate the system primarily. So you have needs for a person and you don't know how to get to the right doctor, the right social service, the right eligibility paperwork to get your benefits. Case and care management services can be employed to help connect people and to help monitor those services, make sure they're linked to the appropriate service and that it's well monitored. So you've got somebody overseeing some of that. Representative payee programs, those are really just to help pay bills. It's to receive the income that's coming in and to pay the bills and maybe manage allowance for a person. That can be employed if that's a particular issue that the individual is struggling with. Community advocacy systems, you know, if you just need an advocate to stand up for you, to really say, you know, to advocate for a particular need. Joint checking accounts, if you have a person that you use in your family and you want to put them on your joint checking account, they can act as your agent paying bills and managing what's coming in and those kinds of things. And then there's lots of community agencies out there that provide a whole host of services.
If I could just add a little bit to that, the importance of alternatives to guardianship, thing that you have to know is that that has to happen before there's a question of incapacity. If you want to give someone authority, power of attorney, establish a trust, you have to be capable and competent in order to make that happen. Where you get into a little bit of trouble is if a physician has suggested that your person has some sort of dementia, and from that point forward, they want you to, oh, you better do a power of attorney. It may already be too late for that to happen. There are questions that arise when a government agency may see that intervention as you trying to put your name on a checking account after your mom, per se, has been diagnosed with dementia. That may be a red flag, that perhaps your actions are not true, that there may be some form of manipulation going on there. So if you want to establish an alternative to guardianship, it absolutely must be done before there's a question of capacity.
That's a really good point, Sue. And we have seen that where there's a petition that's already filed, there's a physician certificate that says they believe this person to be incapacitated, and we see family members or others still acting as agents and getting on joint checking accounts, withdrawing money, selling property, those kinds of things. And so that's a good way for a well-intentioned person to get themselves into a lot of trouble. So that's an excellent point. In this last legislative season, there were a couple of things that came out that are some additional options for people in terms of alternatives to guardianship. SB 121 was a proposal for a durable power of attorney for health decisions for a person with any form of dementia. And this is a document that was created based on another document for individuals who have intellectual or developmental delays. There was always a durable power of attorney that existed, or not always, but there has been a durable power of attorney that has existed for people with intellectual and developmental delays. And advocates really got together and said, we need something like this for people with dementia. And so this means you can have a diagnosis of dementia and still not be incapacitated, but you have your diagnosis. Because as we know, as medical professionals know, capacity really is very situational. You can have capacity in the morning and you may not have it later on in the afternoon. You may have it around your personal and social life. You may lack it in your financial life. And so capacity is not something that is you have it or you don't. It's very situational. And so you can have a diagnosis of dementia and say, okay, I've received this diagnosis and I want to put some things in place. And this is my person. I've chosen Sue. Sue's going to come in. And what the statute did was it created a form that's very easy for anyone to navigate through. So you can find that form as a regular, person. You just can Google SB 121. It's also in NRS Chapter 162A, and it gives you the form to fill out with your person. You can sit down, you can work through it together, you can have it notarized, and that person then can act as your agent. So that's a great alternative for people with in the earlier stages of dementia that have been recently diagnosed. SB 480 established a Supported Decision-Making Act, which came out of our schools, actually. And it was really, came from the intellectual delay for intellectual disability and those advocacy groups. And so this is a process whereby if you have a intellectual disability that may impact your ability to make decisions about certain things, you can say, this is my person who's going to come with me and make my decisions with me. Again, it's a form that they've created. It walks the person through it. I've seen this alternative employed particularly for young folks who are on guardianship with their parents, but they might be 25 years old and their parents want them to have a level of independence. And so this has been employed recently. It's brand new. We don't really know how this will function for getting people off of guardianship, but it is a possibility that we may get to a place where we can move somebody off of guardianship and into a supported decision-making agreement, and thereby restoring a lot of their civil rights. So we're pretty excited about that. All righty, has our judge joined us?
I haven't seen anyone new, unfortunately.
Okay. So we're going to just talk briefly, we'll go back and just discuss a little bit about, Sue's going to kind of talk a little bit about capacity versus competency and some of the highlights to know about that.
Okay, so when you're looking at capacity, the process of guardianship includes that there's been a level of concern brought to a medical professional's attention. So you take somebody to the doctor and they have concerns, whether they're not taking their medication, whether they can't pay their bills, and the doctor says, I don't believe that this person has the capacity to continue to make these decisions. In order for guardianship to move forward, that document that the physician fills out indicates the diagnosis that is related to capacity and the issue, whether it's dementia, whether it's traumatic brain injury, whichever. And then the process is that that then is filed with the court. So the difference is that the physician makes the recommendation and indicates, I think that this person is susceptible to undue influence, is endangering themselves, suffering from self-neglect, and I'm going to offer my opinion to the court, and the court will make a determination about their ability to function out in the world and whether or not they need the oversight of another individual. So the court makes the determination. So in order for a guardianship, unlike a power of attorney, in order for a guardianship to be able to move forward, it has to be adjudicated through the court. Sometimes we operate in a relatively siloed world, and sometimes with the physician being at the top of the food chain in the medical community, they insist that their opinion is the determining factor. And once they have written the physician support, the physician certificate for incapacitation, that means that that person can no longer make decisions for themselves, but that is not the case. So again, the physician is making a recommendation to the court to be able to, and the court is the one, and of course the judge is at the top of the court silo of that legal network, and the judge then says yes or no, or we need to think about this some more, we need more evidence, do an investigation, whatever that happens. So sometimes people get a little bit nervous, physicians will get a little bit nervous about allowing a person to discharge from the hospital, let's say, if a physician has indicated that there's a level of concern about their ability to plan or establish their home situation. But unless the court has deemed the person or appointed a guardian, that person has the right to discharge themselves if they so choose. You can usually talk people out of that if you have concerns for them. There are alternatives in terms of legal holds if there's that concern. Those are also alternatives. But until it goes through the court process of competence, that's the judge's determination. He gets to decide what happens.
So our judge will often tell people that people in prison that he has sentenced as a result of a crime have more rights than people on guardianship. And so he says that to people often because he really wants people to understand the impact to the civil liberties. And that's why our courts take it so significantly. We have a little case study and I'm just looking at our time, and I know that there may be some questions. And so I'm gonna, this is the part where you get to kind of participate. So I'm gonna buzz through it kind of quickly on our end, and then open it up in case you have questions or thoughts on some of the scenarios, okay? So we're looking at Mr. Jones. He had a recent fall at home resulting in a broken hip, and it was repaired with his consent. But he contracted a postoperative infection while he was hospitalized. This is not a real case, it's a made-up case, just so you know. He was discharged to skilled nursing following some antibiotic treatment, and while at that skilled nursing facility, he demonstrated some confusions and forgetfulness and at different times of the day. So the patient demonstrated cooperation in rehab activities, but he failed to initiate his own because he couldn't remember what he was supposed to do. So he couldn't complete his physical therapy. He never recalled what he was instructed to do. It was recommended that he discharge to an assisted or living or group home. So I'm curious what your thoughts are. Should a guardianship be pursued?
I don't think so, because it sounds more like a case of delirium versus actual new onset dementia.
Right. Very good. So this could be a temporary type of situation that could resolve. It's probably too early to actually take a look at guardianship, right? So we're going to move on. So next page, we have, oh, is it going? Oh, did it go twice? Okay, we got it. All right, so what happened to Mr. Jones is that the social worker evaluated his income and his assets to determine placement options. And then Mr. Jones was able to tour a placement. She found something he could afford. He went, he toured the placement, and he decided to go there. And so the social worker referred to a representative payee program to help manage some of his finances. And Mr. Jones asked help from his apartment manager with whom he had a good relationship to pack his things. And he consented to redirect his funds to the representative payee. And he was able to go down with the representative payee to the bank and actually manage that and close his account. And the social worker assisted in completing the Nevada Medicaid application and referred him to the home and community-based waiver. So those are all right there. Those are all alternatives to guardianship. Every single one of those a highly functioning social worker could accomplish for Mr. Jones. But these are some reasons why we might say, you might need a guardianship. Same situation, but what if your social worker didn't, this particular social worker understood what steps had to be taken, and he was clearly explaining the options. He had a good relationship with his apartment manager. He was cooperative with the representative payee. He was cooperative with his rehab team. Those are all indications that the guardianship is not needed. But just a few of these things could change and could alter that. What if Mr. Jones is not very cooperative? What if Mr. Jones actually had that confusion and those symptoms really progressed very quickly, and he was actually diagnosed with dementia? He couldn't participate in this planning. What if the social worker did not understand kind of what the steps were that needed to be made? A social worker might have just made a referral to guardianship instead of kind of going through that process. What if he couldn't access a representative payee program for some reason? What if our home and community waiver was closed, like it is now, and they weren't accepting new people, and he had to go on a wait list? What would happen then? So those are all different kinds of things that could happen that could sway the tides for Mr. Jones. And we put that out there because guardianship isn't a yes, it's a clear decision, or no, it's not a clear decision. Lots of things can influence that particular decision. And lots of different scenarios can exist where you pursue alternatives and then you decide, now it's time for guardianship.
So this last one, HCBS is not accepting new people. From my judgment, that's not a reason for guardianship. It's a lack of services, not a failure of his ability to comprehend.
You'd have to have multiple things right here that would have to impact that decision. So you're absolutely right.
Yeah, we always need more resources.
Yeah.
So what if Mr. Jones, let's imagine from the first scenario, the social worker did not know actual steps to go by, and there's a family member who wants to be a guardian. So suddenly he becomes a guardian and Mr. Jones improves. So is there a way he can go back and revert the guardianship?
Absolutely.
Yes.
So a guardian should always be considering whether or not guardianship is still needed. We need to regularly ask ourselves that question: is this still in the best interest of this person? And just like you can go to court to get a guardianship, you can go to court to get out of your guardianship and to terminate your guardianship. Those are best case scenarios. Yeah.
We love that one.
We celebrate those.
So I'm curious about the hearing. Let's say somebody files a guardianship literally against somebody. So what are the protections for the person who might be the protected individual? Do they get to go to court? What if they don't have funds? Who represents them?
Yeah. So in Washoe County, primarily Washoe Legal Services is the provider of attorney for proposed protected persons. There are some other attorneys in our community that will do pro bono work as well. And so sometimes that can happen sometimes prior to the attorney, but if a person were to get to, or prior to the hearing, but if a person were to get to the hearing and they didn't have representation, the court would appoint representation for them. They may use Washoe Legal Services, or they may appoint a pro bono attorney in our community. Washoe Legal Services also serves some of the outstanding, like Carson, Douglas counties, the close counties. There are also advocacy groups throughout the state that will serve as that function. So according to statute, now every protected person must have an attorney. That was not always the case. That is new law that has been enacted, I think, in 2017. So there are currently protected people in the state of Nevada who do not have attorneys, but as they come to court, those attorneys are getting appointed for them, and people are evaluating if indeed we need to assign one. They're all entitled to them. And that is a due process. So just like any court process, they're entitled to object, they're entitled to have representation, and they don't need to have funds to pay for that.
That process has to be, the court cannot appoint an attorney to represent that individual until a petition for guardianship has been filed with the court. That's the action that triggers the intervention of the judge. The judge just can't like randomly walk outside and say, oh, you get an attorney, oh, you get an attorney. So there has to be an action taken by some entity who has concerns in order for the judge then to say, oh, okay, this person needs to be represented.
And yes, they still have the same constitutional rights that anyone would have facing legal action. You have the right to face your accuser, to question the people who are saying you need a guardian. You have the right to representation. You have the right to present your own evidence. All of those constitutional rights that everybody has still exist for those people, which can make the court hearings long and delayed, and sometimes you have to come back like you would with any action in court, and some people can become frustrated with that. But that's our constitutional right, and we should be protecting that.
Additionally, right now, the law indicates that a person needs to be present. The
That was my next
the
question.
proposed protected person needs to be present. Judge Walker wants to see that person. He wants to be able to have a conversation. He wants to be able to reach out and have that. He is also incredibly flexible, and he will go. If that person cannot come to him, he will go to that person. That does tend to draw out the experience because we all come and he says, oh gosh, they're not here. So, oh, I'm going to go. So let's look for another hearing date. So the process is definitely time consuming.
Is it just for Washoe County, or is it universal that they have to appear in the court?
That's a universal constitutional right. Everybody has the right to appear when they're being accused, or it may interfere with their own civil rights. They have a right to be there. Not only should they be there, but they have a right to be there.
And our statute supports that. It does give the option for their attorney to waive their presence. Certainly there are individuals who may not be conscious, who might be medically fragile, who cannot, moving them from their facility to court may be disruptive to their care. And in those conditions, their attorney will come to court, represent that, ask for them to be excused from the court process.
I know we're coming close to the end, so we want to make sure that we have the opportunity to see if any of the participants have any questions for our speakers today.
I saw some of the comments earlier.
Yes, so pull the chat.
So what are the legal, how do I phrase this? For determining capacity, does it have to come from a doctor, or as a PA, is that something that I can sign? Because I've been asked by some of my patients to sign that, and I sit there thinking, I'm a PA, like, yes, I'm a trained practitioner, I can take care of your issues, but legally within the state of Nevada, do I have the right to sign those types of forms?
That is a good question, and I wish our judge were here to answer. Say that again?
You actually can. What the law says is that there's a medical provider is the person that can complete that form. Also a social worker, also a person from a state or local agency that can bring that. Where the breakdown is if the judge feels like there is adequate information, if the medical record that is provided supports that information, because he can say this isn't enough. So it isn't a guarantee as a PA. More information is always better. Additionally, to remember that it does become public record, so you want to be cautious about what you want to share with the world if the world were looking. But yes, you can. That's the law.
Okay, because I got one of those forms about 3 weeks ago, and it actually said doctor on it, like have your doctor fill out this form. And so that's why I was like, oh, am I allowed to fill this out or not? And I had already tried to refer her to a neurologist. And so I told her, I was like, no, you need to go see the neurologist, like, because it's saying a doctor and I'm not a doctor. But you're saying that I could potentially have filled that out.
There are people who have successfully completed that document as a PA in the past.
There you go. It's not a guarantee.
Okay, perfect. Thank you.
Jen? My question is, I was always under the impression that a private guardian, always kind of revolved around family or friends. From this presentation, it almost appears that I guess maybe there are agencies that represent private guardians that, you would pay to be your private guardian. Do you guys have any resources or names of agencies that provide private guardianships that aren't family or friends of what would be a board?
I don't know where this person is.
Kelly, I think you are in Las Vegas, is that right?
No, I'm not. I'm in the rural, so my territory is firmly foul in Silver Springs, but I'm curious in general because I've just never heard of a private guardianship being anything other than family or friends.
Yeah, there are definitely private guardianship companies that offer that. There's
I don't know of any in the rural.
Yeah, I don't know, but I
the
think
gentleman that comes from the rurals to the guardianship,
he's with Washoe Legal Services, whatever the rural legal services is, I think. But the Guardianship Services of Nevada was a private guardian agency that worked out of Washoe County. They have been absorbed by a trust company that's called Dunham Trust. They are local. They don't have the restrictions on where they can operate. A private professional guardian can operate wherever. They can go to the county of residence of where the individual resides, and they can petition that court. Washoe County, the public guardians have to stay within the structure of their county, but private guardians and family members can go to where the individual resides.
So I guess what my question is I know, at least in the rurals, what my two applications look like for guardianship for private and public. And in fact, I've gone through both processes before. With the private guardianship paperwork, it asks, who you intend your private guardian to be. So would it be proper procedure for, let's say, if somebody didn't have family to be a private guardian, but I guess they did have money or assets and wanted to hire versus go in public, is the proper procedure to get a hold of a private guardianship agency so they understand or know that their name is going to be on this legal paperwork that's going to be submitted to the courts? Or do you just do it and does the court process happen and then they get a hold of the agency? Or
it's a different process for when if you engage a private guardian will help you walk through that process. They will have an attorney that they often use and who will represent them in court. So it's not like an impro per packet that you would utilize if you were a family guardian petitioning for guardianship. If you reach out to a private guardian, they will have that conversation with you about whether or not it's a match or a fit with your protected person and them, and then they will assist you in the process of petitioning the court.
Gotcha. Thanks so much.
I know we're a few minutes over time, and we have a short survey for you to complete. And also, we want to make sure that you know that we're moving to Tuesdays, so it'll be the third Tuesday starting next month, same time, 12 to 1. Okay. Thank you.
Thank you.
Thank you.